Hi, and welcome to a short video about building connections, vaccine conversation strategies. My name is Emily Gibson, and I've worked as a nurse for 6 years, both in hospitals and in the community setting. I currently work for a public health nonprofit called Village Reach, based in Seattle, Washington. This video will go over some strategies for building connections and having compassionate conversations about COVID vaccines. This is the third video from Okanagan County Public Health, and there are 2 other videos covering the latest information about COVID-19 and COVID-19 vaccines. If you'd like to feel more confident engaging with vaccine conversations, I suggest you also watch the latest updates videos 1 and 2 if you haven't already. In part 1 and 2, we share the latest updates about COVID-19 in Okanagan and go over common questions and concerns about the vaccine and how to respond to them. The goals for this session are to get up to date with the latest research on vaccine hesitancy and communication strategies, and go over suggestions so that you feel ready to support people in your life, colleagues, friends, family, anyone really, who express concerns about the COVID-19 vaccine. I've been asked to share this information because so many of us are now involved in situations where we're brought into conversations about COVID vaccines, maybe online or with friends or at work. And these conversations can be really stressful and uncomfortable, and it can be hard to know how to have a productive conversation without it turning into an argument. Hopefully after this video, you'll feel more prepared to engage in these types of conversations in a way that really focuses on the needs of the person you're talking to. So what is vaccine hesitancy just as a concept? This model here shows a range of levels of vaccine acceptance. This model can be used for all vaccines, not just COVID vaccines. We start with the green box on the left with people who accept all vaccines, and then moving on to the box all the way on the right, people who refuse all vaccines. What we're focusing on today is having conversations with people who are hesitant or on the fence about getting vaccines. Those folks are in the red box in the middle here, and are people who may have some concerns and questions or may not be ready to get vaccinated right now, but might be open to vaccination at some point. So who is still open to getting vaccinated? How many people are on the fence? This graph shows on the left where things were in the US in April and where things are now in August on the right. The blue line at the top is people who are already vaccinated, which you can see is going up and is now reached about 70% on the right. The other 3 lines are unvaccinated people. So the 15% line in brown, so on the right, you can see that 15%, is people who are unvaccinated and said they are not at all likely to get the COVID-19 vaccine. The other 2 lines, totaling 13%, said they were either not very likely or very or somewhat likely to get the vaccine. So overall, these data suggest that about half of the unvaccinated people in the US are still somewhat open to vaccination. It's important to remember that the strategies and messaging used at the beginning of the vaccine campaign probably won't be very effective anymore. So folks who are still unvaccinated may not appreciate the really loud and energetic vaccine strategies from earlier in the year. Unvaccinated folks might be balancing a lot of factors. These could include feeling stigmatized for being unvaccinated in certain communities. People may fear pushback from their community if they do choose to get vaccinated, and this doesn't line up with the values of their friends or family. Some people might feel really alienated by intense pro-vaccine messaging, and many providers are noticing that patients are expressing a lot of fear about side effects that they've read about from inaccurate information sources. Folks might also prefer privacy. They might not want to sort of out themselves as someone who isn't vaccinated yet, or they might not want to get vaccinated in a public space. Keeping in mind what we just covered about differences in communication needs for people that are on the fence about getting a COVID-19 vaccine, one of the best strategies we can use when engaging in one of these conversations is called motivational interviewing. Motivational interviewing, at its most basic, is essentially just a compassionate, intentional conversation focused on the needs of the other person. This is a technique that nurses and providers have been using for years in healthcare, which is aimed at exploring people's reasons for hesitancy and understanding their attitudes and willingness to change their behavior using open-ended questions. The strategies used in motivational interviewing can be used by anyone, not just health professionals. This process moves us away from trying to intensely convince someone, but instead to calmly and compassionately exploring their priorities. Motivational interviewing is used in many areas of healthcare, including, for example, when having a conversation with a patient who smokes and maybe they're considering quitting smoking. So in motivational interviewing, we aren't trying to forcefully convince someone to change their mind, but just encouraging them to explore their own perspective while also creating opportunities to share information if they're interested. So conversations about COVID vaccines can quickly become really heated, and it can feel hard to find common ground. But if you're feeling frustrated or angry while engaging in these conversations, you're unlikely to build trust with the person you're talking to, and you probably won't get very far. So I'm going to walk through 5 steps for an effective conversation using motivational interviewing. This can seem sort of formal, but it's really straightforward. We want to start by figuring out where the patient falls on the hesitancy scale. I showed the one that I showed earlier. So are they absolutely refusing all vaccines, or are they sort of on the fence or unsure? And then next, you'll follow up with open-ended questions and then go from there. We'll walk through the 5 steps here with examples for each one. Step 1 is to ask open-ended questions. This is how you'll want to begin the conversation. It's really important to keep in mind here that someone who's on the fence about getting vaccinated has probably already done a lot of research. So you could ask, what do you think about COVID vaccines? Or what do you understand about how COVID vaccines work? This is really helpful to get what the person that you're talking to already knows and where they got that information. One of my favorite suggestions I've heard for this part of the conversation is to ask somebody, how likely are you to get a COVID vaccine from 0 to 10, with 0 being not likely at all and 10 being very likely? And if the person says 3, you could say, okay, so why are you a 3 but not a 0? And then you can explore those reasons together. Step 2 is to reflect and respond. There are 2 types of reflection. Simple reflection is where you directly repeat what the person says. And complex reflection is where you repeat what you kind of think the person means. So if your friend tells you, I know vaccinations are important, but I'm really afraid of the side effects, a simple reflection would be, I understand that you're afraid. Or complex reflection could be, it sounds like you want to make the best choice, but you're nervous. Reflection is a great way to show someone that you're listening to them and to make them feel heard and respected. Step 3 is to affirm strengths and validate concerns. This is another way to help make the person that you're talking to feel affirmed that their thought processes are reasonable and that you've been listening to their concerns. So if someone tells you that they're on the fence, you could say something like, it's really great that you're starting to think about COVID-19 vaccines. Or if someone says that they aren't sure about the vaccine, but they've been wearing masks and they've been really limiting their social activity, you can say, I can tell that protecting yourself and your community from COVID is really important to you. The 4th step is ask, provide, verify. So this is the point in the conversation where you might be starting to build up some trust and connection. So you could explore their background knowledge a little bit more by saying something like, so what are your main concerns about COVID vaccines? Let's imagine they tell you that they have some concerns about the way the vaccines were developed. If you feel like you're comfortable sharing some information, maybe something that you found powerful or that helped you feel comfortable getting vaccinated, you could say, hey, can I give you some information about how vaccines were developed that made me feel more comfortable about getting vaccinated? And later in the conversation, you might then want to check and make sure that what you said made sense or get a sense of how the other person is feeling. You could say, after our conversation, how are you feeling about COVID vaccines? And finally, you'll want to close out the conversation by summarizing and determining what the next steps are going to be. So if the person indicates that they're now interested in getting vaccinated, that's great. You'll want to support their decision and then try and make it as easy as possible for them to get a vaccine. So can you pull up appointment times on your phone or look up a walk-in clinic for them, or maybe they need a ride? Just try and make things as simple as possible. If they're still unsure, which is honestly the most likely outcome of one of these conversations, you can encourage them to continue the conversation with their primary care provider or with you at another time. You could say something like, hey, we just talked about a lot of information. You don't have to make a decision right now. Why don't you think about it? And then if you ever have any questions, you can always reach out to me again. If someone's adamantly refusing a vaccine, do not debate it. Leave the door open. You could say something like, I totally understand that you still have some concerns. Please know that if you change your mind and want to talk, I'm always available. So that's the process for motivational interviewing. But if that feels a little bit daunting or too formal, you can also consider some of these suggestions for a compassionate, non-judgmental conversation that could be used with anyone in your life about COVID vaccines. So the first is sort of obvious, but it's to be positive. So people want to hear benefits of getting a vaccine more than the consequences of not getting it. The second is to recognize the personal choice. People want to make their own decision and not be told what to do. So don't sell the vaccine, just provide factual information and try to answer questions objectively. Next, try to keep politics out of it. Regardless of their or your party affiliation, anything political is probably going to get tuned out. Next, if you feel comfortable getting kind of more into the details about vaccines, you can compare potential risks with proven risks. So to address somebody's concerns about side effects from the vaccine, you could acknowledge their concern, but then contrast the unknown risks of getting a vaccine with the known dangers of getting a virus. And if you feel comfortable, you could also consider explaining the speed of development. So you can explain that scientists were able to develop vaccines faster, not because we cut corners, but because we cut red tape and bureaucracy. And finally, don't judge, attack, or shame. This is a time for listening, not attacking or name calling. So acknowledge that it's reasonable for somebody to have questions about a new vaccine for a new disease. If you're interested in more information about these points, then you can find that in part 2 of the latest updates video. So that's it for our overview of motivational interviewing and strategies for vaccine conversations. If you would like to feel more confident engaging with vaccine conversations, I suggest that you also watch videos 1 and 2 if you haven't already, where we share the latest updates about COVID-19 in Okanagan and go over common questions and concerns about the vaccine and how to respond to them. If you have questions about this video, we encourage you to reach out to Okanagan County Public Health at the email address listed here. You can find daily COVID-19 updates at the Okanagan County Public Health website, and you can also see updates on the Okanagan County Public Health Facebook page. Thank you for listening.